Sickle cell anemia. Sickle cell anemia is an autosomal recessive genetic blood disorder characterized by red blood cells. A person could only have sickle cell anemia if both of their parents are carriers, or one of the parents is a carrier and the other is affected. Sickle cell anemia is present at birth, but many infants don't show any signs until after 4 months of age. If a person has homozygous dominance as a trait, then that person is not affected. If you have heterozygous as a trait, then under normal circumstances, you have no symptoms of having sickle cell anemia or have some blood cells that may be affected. Being homozygous recessive means that a person is definitely affected and has sickle cell anemia. Normal blood cells are disc-shaped and look like donuts without the holes in the center. They move easily through the blood vessels. Sickle cell anemia causes the red blood cells to become sickle-shaped or crescent-shaped. Sickle cells are stiff and sticky, which make them harder to go through blood vessels. Why is sickle cell anemia bad, or what does it do? Red blood cells contain an iron-rich protein called hemoglobin. Hemoglobin is a protein which carries oxygen from the lungs to the rest of the body. Sickle cells have abnormal hemoglobin, which tend to block blood flows in the blood vessels, limbs, and organs. Blocked blood flow can cause pain, swelling of limbs, and organ damage. It can also raise the chance of any infection. Where did sickle cell anemia come from? Sickle cell disease affects millions of people worldwide. It is most common among people whose ancestors come from Africa, Greece, Turkey, Italy, India, and Spanish-speaking regions in South America, Central America, and parts of the Caribbean. It is common in those areas because there used to be large cases of malaria. It is now assumed that the presence of sickle cell trait protects individuals against malaria. Malaria parasites are parasites that invade red blood cells. Individuals carrying the trait die with the cells when the latter assume the sickle shape and adhere to the walls of the blood vessels. Sickle cell anemia originates from Africa and places where there were incidents with malaria and spread because people started to migrate to different places around the world. So why did sickle cell anemia occur? The hemoglobin S, sickle cell, mutation that protects against malaria did not develop as a response to malaria itself. It occurred by chance. Those people without the mutation living in areas where malaria epidemics were common were at an increased risk to contract this infectious disease, getting symptoms of high fevers, headache, muscle pain, enlarged spleen, and anemia, or lightheadedness. People carrying only 2 HbA non-sickle cell genes often died in their first few years of life. Those who were lucky enough to carry the sickle cell gene when malaria struck had a better chance of living. They would survive to produce children, and their sickle cell carrying children in turn would have more sickle cell carrying children. Signs and symptoms of sickle cell anemia. The signs and symptoms of sickle cell anemia vary. Some people have mild symptoms, others have very severe symptoms and are often hospitalized for treatment. The most common signs and symptoms of anemia is fatigue or feeling weak. Other symptoms include shortness of breath, dizziness, headaches, coldness in the hands and feet, paler skin, or a yellowish color of the skin or whites of the eyes. There are many complications that vary with sickle cell anemia, such as hand-foot syndrome. This usually occurs with children younger than 4 years. It leads to pain and swelling in the hands or legs and causes fevers as well. Other problems that sickle cell anemia can lead to are strokes, problems with visions, that means eye problems that can cause blindness, multiple organ failures, and etc. The most biggest complication sickle cell anemia leads to is a shorter life expectancy. Life expectancy and treatment of sickle cell anemia. In 1994 in the U.S., the average life expectancy of persons with this condition was estimated to be 42 years in males and 48 years in females. Today, thanks to better management of the disease, patients can live into their 50s or beyond. Bone marrow transplantation is the only treatment option for the sickle cell anemia, but this is a difficult and risky method. However, it will help in avoiding complications, reducing the effects of the symptoms, and decreasing the pain. Now that people understand this condition much better, there is also ways to prevent sickle cell anemia and also diagnose it. The possibility to diagnose sickle cell anemia is in its earliest stages during pregnancy. If a mother has sickle cell anemia, she can prevent her child from having it through controlling the change in red blood cells. Thank you for watching and listening.